get started. So 3 good things. Lucy, you put one up there. Talk
So
about
I
Edna.
went to get more contacts last night and to order more glasses, and I had encountered Edna like a couple Saturdays ago when I had my eye exam, and she was struggling with the machines a little bit and whatnot, but like last night she's like, she's like, oh, did you just come from work? She was super friendly and whatnot. I was like, yeah, I work at Abbott, and she's like, really? She's like, do you know Dr. Naguib? And I was like, well, yes, I do. She said, she goes, I had a tumor removed, and he was really good, and she was talking about that, and I was like, did you spend any time on the 8th floor? And she's like, yes, and she said they were so good. And I was like, so I told my tier 1 that today, because I'm like, when you go out in your own community and you're talking to people and they say, and they were, you know,
Right.
it was very heartwarming for me to hear that. And she said, and I have to come back, and she's like, and I'm not even worried about it. And so
That's awesome. Small world. That's
Yes.
very good.
Very
It is a
good.
very small world, and in fact, as you know, I was in DC this week, and when I was meeting with our representatives, I was meeting with Amy Klobuchar's office, and she's in the judicial hearings this week, so I met with her staffer, and I started talking about some of the things that are important to us, and her staffer was very, very familiar with Abbott Northwestern Hospital. Started asking some very pointed questions about the physicians and some of our practice patterns here, and really gave praise to Abbott. Asked some questions about how we're going to manage next year and how we're going to do that different than we did in 2016. So it was very up on the issues, but was very clear about what Abbott Northwestern is and who's here and what happens here. So I think, you know, you can be out in the community getting eyeglasses and contacts, and people know. So, you know, we always represent where we're at, and can be very proud of that.
We had a nurse whose last night, and she said that her experience here at Abbott was the highlight of her nursing career. So that was pretty awesome.
That's really nice.
Really?
Oh, who was that?
Courtney Fair.
Oh, she's leaving?
Yeah.
Yeah.
Or no, Courtney Falk, I'm sorry.
Courtney Falk.
Yeah.
Oh, yeah.
I always get those two.
That's nice.
I got goosebumps. That's awesome.
Oh, that is.
That's really cool. All right. Okay, hospital census is what, 5:12 or something like that today. So we're clipping right along for a Friday. 7,000.
You are going to say, so I didn't know if you wanted to see it right there. I'm at a census of 28. I have 8 patients coming in. I can take one now. I have 6 to 13 to go. I have no one-to-ones, no failed ROBs, and no ROBs. We're staffed okay. I know there's a few minuses, but that's, we're looking good. So not going to be quite at our full target. We do have 4 patients currently that have Foley's in greater than post-op day 2. But I've spoken with the charge nurse, and she'll be addressing that today. No other safety issues in the last 24 hours. And then we have no equipment supply issues or employee injuries in the last 24 hours.
Cool. Thanks.
Yep.
We're at 28. We have 7 coming in. 1's early, the rest are later. 1 to 2 we can take. I think we're taking somebody from PB 2000, so probably just 1 at this point. We have 8 to 14 discharges, no ROBs or sitters. Our staffing looks okay, right at target. We were down a little bit this morning. We have 1 Foley in that's been greater than 2 days, no other safety concerns, and then our otoscopes aren't charging. So I've had the 2 PACs reach out to Biomed, and I haven't heard an answer quite back yet, so I'm going to follow up with them today and see what's going on with that. Our bases are new, so it's not the same issue as other floors are maybe having with old bases, because we just ordered those, so I don't know what's going on with them.
Okay.
Interesting.
So no help from you for my problem.
Sorry, maybe later today I'll have a better answer for you.
I'm kidding.
If you need help, let me know. Okay.
Okay, so I have 38. 1 direct is going to be here in the next couple minutes, so probably 39. I have 7 later surgicals coming. I have 2 for admittability. I have 2 that we've already identified as early discharges, and we'll for sure do 3. And then 6 to 8 total. I have 1 one-to-one that's we're planning to discharge. She's one of our early surgicals to Unity today, and so we're planning her to go this morning. I don't have any ROBs, and then I have 2 Foleys in. One's a comfort care patient that chooses to have it, and the other one is a patient from a group home that has like a long-term Foley, and so she's had it in for a long time. So.
Okay. Rehab's at 26. We're going to get 1 to 4, 2 discharges, no one-to-ones, 2 ROBs. We have an extra NA because of our geographical area, and we have no quality issues, so we're doing good.
There you are. Awesome.
Endo's at 16, we have 1 in the OR, though we're trying to pull that one back up. We are starting to plan. We have no safety issues, but we do have a fluoro is short today and can't guarantee that we can do 2 floors floral cases that we have scheduled at the same time. This is the second time this week that this has happened, so I'm bringing it up. I know they've had 2 ill calls, but the more floral we are using, the harder we're putting on them as well. So I know they've had a change in management, and so the schedules are a little wonky from what I'm hearing. But anyway, I thought I'd bring it up because this is the second time. We won't know till this afternoon how that's going to play out. Whether
Who are you working with downstairs?
Well, the one that like got my pads and stuff was Kevin, but that I think there's somebody else in that, but I haven't heard the name for that person who's ever covering.
So Kevin's one of the managers.
Correct.
Yeah, so he's aware of it and he's trying to
Yeah,
help
but
you
I don't
mitigate.
think he's gonna be the floral one. I don't know who the floral one is, but I'm bringing this up because we're a lot of times having floral, or like 2 fluoros. But then ASC also has a fluoro, that's 3 of their techs. So it's an increase there. We have 3 anesthesias when we need 3 anesthesias.
Let's just spend a little bit of time talking about mitigation on the fluoro stuff and like how we can maybe look ahead and understand more like what their staffing is so that we can have an ask of Kevin and or Julie, their director, to see how we can get some help for that. So let's just talk afterwards a little bit more about it. Shelley.
We have 115 points today, 7 therapists on with 16.4 points per person. 16 vents currently running, 18 after the hearts come out, 3 BiPAPs, 15 CPAPs at night, 3 trachs in-house, no transport scheduled, and we're in the green.
Okay.
Staffing, we're overstaffed for the next couple of days because our points are down.
Your points are down. Do you have any education or anything anybody could do?
Right now.
Critical communication. So excelling in downtime coming on Sunday, so Saturday into Sunday. I'm sure your PACs, you've been working with your PACs to make sure that they have packets ready and all that. Thank you to everybody for getting the budget sheets filled out. If you need help, just let me know. I'll find some space in the day to make that happen, seeing that that's our priority right now. So that updated sheet came out. I think you've put yours on the S drive. So I've made a folder on the S drive for that. Anything else that we should have up there? It's gone this week, obviously, so I'm not totally in the know. Patients and families, what do they want us to know?
One thing that I'll share, I'll follow up with Sarah Shirai, but a concern that came from a patient was you keep telling me to push the red button, you probably shouldn't have a telephone that has 2 red buttons on it. So it's kind of funny because we've always said push the red button and it's on the side rails and the call light, but our white telephones, both sides have red buttons on them, so they get confused when they're already confused. So I was just going to reach out. I'm not sure that anything can be done, but I thought it was an interesting point.
Yeah. It's funny when you're laying in the bed and
Right?
you've got time to think or ask for help. And I see this came up yesterday, ortho
Yes.
program manager position. We have no answer. I mean, that's on hold, and I don't anticipate that it'll come off hold for a period of time with Navigant in. Those discussions, so Jenna has been starting to sit, Jenna and Jenny, as directors have been sitting with the Navigant teams across the street. And we don't have a lot coming on it yet, but until that's sorted through, I'm confident that this will be on hold. So.
Although I'm totally invested in that answer, I did not bring it forward to the group.
Yep, that's okay. It's okay. That's what we want as questions to be asked. Anything else you want to know from leadership?
My staff want to know why we can't have cloth linen bags versus those blue plastic. I'm sure it's a cost issue.
Or sanitary.
Or an infection control.
Yeah, something.
They think the cloth would be better?
Well,
What's-
environmentally.
Environmentally.
So, who do you think can reach out to get the answer on that? Do you think like a Jess Nervy? Or a Tracy White?
Don't they melt?
I don't know.
The plastic?
Well, yeah, I mean, recycle, I take my plastic bags to Target to recycle them.
I know, but I'm sure they're not recycling those blue bags.
I always think of like, what about like the wet linen that gets
Yeah, I
put
was
in
thinking
those?
that
And so
too.
like if you had a cloth bag,
Yeah,
it'd
I
just be
don't know.
gross, but
Right.
I don't know, I mean.
Yeah, that I would.
Maybe
think it's.
Cause there's
If
always
they-
wet
you're-
beds and
So
wet-
probably.
Maybe start with Tracy White, cause she's the one that has to buy them, right? For EVS. And so maybe, I'm guessing she's in the loop with somebody like infection control, if you wanna just
Follow up.
drop her an email and educate the rest of us. I'm guessing there's an infection control, but sometimes you don't know. Anything you want leadership to know?
That's for here, so that whole thing with fingerprinting,
Mm-hmm.
all my people went over, we had all their stuff in on time, I had hand delivered it over to HR, blah, 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 they went down, they said, your stuff isn't in. And now it's like, where is their driver's licenses and everything? Well, they actually found them, it had not gone to the other guy, so that they could have their fingerprints, and then all of a sudden they're trying to force, get it done. So hopefully they get fingerprinted today, but we were in on time, so if I had not seen a sheet that said we were non-compliant, But I will say, Nzinga and Schmoyer, Leah were wonderful. I mean, they just helped us right out, so.
Did we drop them in a spot?
Not yet.
Okay.
I'm gonna see if they get fingerprinted today. Then I can add the whole thing,
Okay.
cause they made it happen.
Anything else? One thing I will tell you, so in PCAC yesterday, we talked about the fourth quarter volumes and just continuing to prepare. So we're just gonna pull a handful of people together just to talk about like, how do you know your surgicals and how do you know your volume, and just to try and continue to talk about how do we work towards being more proactive. I know it's a little more challenging for you to get volume, so it's like, how do we get that? NOS community is a big community for surgical volume and flow for fourth quarter. So just know that we're gonna probably pull one or two of you into just a conversation to say, hey, what's your process? How do you find out? How do we keep refining our process and working forward so that we know what we have and can add extra staff or an extra 11 o'clock or whatever. So that topic just came yesterday, so I'll be reaching out to the team. So, good. Anything else? Anybody need to talk to anybody?
Just a quick question, please.
Yeah.